For the splenius capitis, it's going to have a pain referral pattern to the top of the head. The splenius cervicis is going to be along the neck and a little bit lower. The common range of motion test is cervical rotation. Ideally, the nose should be directly over the acromion. Again, she's missing by a couple of inches. And over here again, she's not missing by as far over here, but the shoulder's a little bit more rotated. So in order to treat these, we have a couple of different things. Generally, I would have her in a chair to do the treatment that we're about to do, but in order for clarity, we're going to have her turn. Put the feet up here and face this direction. I'm going to turn her head to the side I want to treat. I'm going to drop the head down. I'm going to bring the arm across the body. And in order to locate the area where I like to treat the most, first of all, I'm going to locate about the C7 area, and we're going to be coming right off the transverse processes through here. So there's a lower area down here that we can treat specifically for the splenius cervicis area in this position. And then in order to get to the upper fibers that I'd like to get, this will be a little bit more tricky for the camera. I usually approach it from behind. I'm going to do it from behind, and then I'll turn her back around and do it a different way so you can see it. So let's go ahead and face the camera first of all. In order to get into this area, what I like to do is find the upper trapezius at the angle of the neck, move the upper trapezius, and the first thing I run into is going to be the levator. I'm going to hop over the levator, and I can treat the splenius cervicis this way. Let's turn around and face me, and we'll do it at a different angle. Again, I would never treat it this way, but so it can be seen. Here's the angle of the neck. I'm going to pick up the upper trapezius, move it to the side, come down, and the first thing I'm going to run into here is the levator. As she turns her head towards me, other way, she turns her head towards me, I feel the levator jump under my finger. I need to hop over the levator and then have her press her head backwards, and that's going to activate the splenius cervicis. So that would be my angle of push. Again, I wouldn't be using my thumb to do this kind of work. I'd be using my fingers to do that. But that's going to get both of those muscles. To get the splenius capitis, it's going to be coming diagonally. I prefer to treat this in a supine position. Let's go on the back, and I'm not going to give you this face piece. Okay. And generally speaking, I would be coming from behind, turning her head to the side, and the fibers are coming across diagonally. I can put my fingers back here and find that without a problem. If I'm having a problem palpating, I can use my thumb up here just beside the eyebrow and have her turn her head slightly. That makes the muscle jump up right under my fingers. Very light pressure here does the trick. And then in order to stretch this out, let's go ahead and sit back up and face them. Okay. And in order to stretch this out, I prefer to do a cervical rotation move, or even better, if she drops her chin down to the chest and bring her hands on top of the head and interlocks them, just rests them there, there's a nice pull all the way down the back. Now she can breathe in through the nose and out through the mouth very deeply. And I like to do this first of all in a central position for 3 breaths. Okay. And then after we've done that for 3 breaths from this position without changing the pressure, I'd like her to turn her head slightly to the right, slightly to the left, that will work. Again, 3 deep breaths. And at the end of those breaths, she will not be moving away from me. She's going to stay in that same position. Good. And after those 3 breaths, I'm going to have her slightly turn her head a little bit farther in the same direction. This is going to get all those muscles. And get 3 more breaths, and then we would repeat the same thing on the other side. At the end of the breaths, she'll use her hands on her forehead and lift her head back up.